Tane, please come on board. And,
Hey,
it's nice to meet you. Bless you. And I only heard about you only on this morning, and we all went, gosh, that's wonderful, and welcome. And needless to say, we're fascinated in what you're involved with, and I would love to know precisely what is involved, and how do we get on board with it?
Okay, the Health Promotion Agency is established under legislation to lead and support national health promotion activities, and our aim is to inspire New Zealanders to lead healthy lifestyles. So obviously it's a big job, and we can't really do it on our own, so we try and establish a range of partnerships and relationships with practices, academics, government agencies, councils, communities, and all sorts of others. So it's quite a big range of areas that we operate on. We also have a range of program areas and things like alcohol, tobacco control, immunisation, rheumatic fever, health education resources, sun safety, nutrition, physical activity. So there's a whole bunch of areas that we are responsible to manage under our mandate.
That's wildly impressive. So how new are you? We've heard about you today.
Yeah. We were established under legislation. We came into being on the 1st of July last year.
Well
so we're pretty new. We've been through with a culmination of a merger between the old ALAC and the Health Sponsorship Council, and also some of the functions of the ministry come under, so all bring us all together under one roof.
So you've got a big job ahead, is it?
Yep.
Have you a very large team?
There's probably about 70 FTEs in the organisation, so it's a reasonable size. Yeah.
So you'll be networking, obviously. You won't be doing this
Furiously?
work on your own.
Yeah. So again, because we've been a merger of two organisations, we've got established relationships in a number of areas, but I think in terms of the from a rural health perspective, we've got to grow more relationships. And
it's a very good point. We're always paralysed with the tyranny of time and distance, really, in the rural sector.
Yeah.
So how are you addressing that?
Yeah, well, that's a good question. I guess the challenge for us is because we're operating at a national level, often probably a lot of the rural people see our messages through mass media and through the brochures and resources that we try and get out to the health sector. We were just talking yesterday in a nursing forum around, okay, we'd love to work more closely with the Rural GP network and try and get more engagement, more activities with that group, and help influence the design and implementation of our programs. So good opportunity.
So in that regard, I presume you guys will be working very closely with you guys to that end. So I presume you will be networking with the rural nurses to. Are they your agents in effect?
We haven't established that relationship yet. We're trying to do it through this, through informal contacts and.
Well, I'm glad you're introducing us to it.
It
all happens here at the conference, doesn't it? That's superb. Well done. That's brilliant. I suppose to that end, our question is, how can we help you do what is obviously a desperately important job? Yeah.
Well, again, for us, it's probably more of how can we help the sector? And I think what we have is an opportunity where we've got all these things under one roof. If we try and look at doing things that span across them, if we can try and network in with the sector in places that the other former organisations weren't doing in the past, I think, just talking, finding out what's happening, finding out what the what people actually want, and also, like I've been talking to people about creating like a national hub of information around. There's so many different groups out there with lots of different information, and so we're starting to connect with a lot of those different players. So I think that's an opportunity that we can try and draw on.
We acknowledge that Rome wasn't built in a day, but so you've got a long way to go. And that was no reference thought on you, Pope. But what barriers are you hitting at the moment, if any, especially with the rural sector?
Yeah, well, again, I think because we're such a new organisation, then yeah, we've got to develop the, you know, some other newer relationships, and we don't have the broad depth and width that you really want to in order to, one, influence, and two, to get feedback to make sure that you're doing things properly, or developing things that make a difference to those different communities. Yeah, so that's probably the one of the biggest challenges for us, and the others, you know, the fact that people just don't know who we are.
But they've seen your brochures and
Yeah,
your
they
your
know your
advertising.
promotional
Yeah, they've seen some of the, although
we're
we haven't explicitly identified ourselves on those, because they were
that's right.
previous, you know, that's from our predecessors, so
Oh, right.
yeah. What do you think some of the other challenges for us are? I'm just trying to think.
It's putting some vim and vigor into health promotion. You know, making it, it's always there, but it's kind of bringing it back to the forefront. I mean, your agency is actually, in my mind, it just is a bit of a prompt that yes, this is important. We need to include this in our conversations with our patients, and you know, those conversations start with the nurses, doctors, you know, clinicians, and you're allowing and supporting us to do that, and
Trying to create an environment to allow that conversation to take place, so that people know or expect that.
And some of that has been very successful. Some of the promotions that you've already done have enabled some of those conversations to happen, and maybe it's just a matter of looking at a rural flavour for some of those promotions.
And the other thing that stood out for me from the presentation yesterday was that the documents that underpin your agency are the Ottawa Charter and the Primary Healthcare Strategy, which are two really good pieces of work that kind of have gotten a bit forgotten in this, you know, in 2013 or wherever we are.
I really appreciate you bringing it up. That's excellently done.
Yeah, so that underpins what he's all about.
Well, I'm delighted to see you here at the conference, and likewise, I think we know we've got these new runs as well, which I'm sure you've been invited to be involved in, if not already. We've just got 1 minute to go, and in that very last minute, I'm just going to throw at you what I've thrown at the other people as well. If I was a fairy godmother and I gave you a magic wand and I could grant you one wish, and Deb corrected me before, this has to be involved in rural health. There might be children watching this programme. So for rural health, what would your one wish be?
For rural health, I guess that people get the best value and service out of our system, that it delivers more effectively, and that people can get to it. So, peace, love and happiness.
Way to go. World peace. You'll win Miss World next week. That's very good. Well done. Well, certainly there is a beauty to what you're doing. Well, I'm afraid we're out of time. I'd like to thank all of you. Tane, thank you. Deb, Karen, thank you very much indeed. And that wraps us up for today. And don't forget to tune in tomorrow when we'll, if nothing else, have Martin and myself giving the highlights of the conference and what we got out of it. So thank you very much indeed for tuning in. Thank you.